Should we get? Yeah, we'll get started. Yeah, excuse me. Okay. So, hi there, everyone. My name is Robyn McIntyre, and I'm one of the coaches, certified health coaches here at Musculo. I'm also trained as a doctor in Australia, and I go back and I work in Australia and New Zealand, which I think is relevant because this is a topic that can get quite complicated. And having just been back there, I think one of my motivations for doing this topic was to really share with people some recent changes in the treatment world around hormone replacement therapy, because I think people need to know that the guidelines have changed and not miss out on an opportunity, because once you're over 60, you're not able to access, well, shall we say, it's not safe or useful to have hormone replacement therapy. So this talk is about lifestyle. And to be honest, lifestyle is particularly important when it comes to post-menopause. It has the most impact, but we'll get to that. So let me go to my first slide, which talks about what we're going to be discussing today. We're going to look at some definitions, exactly what is menopause and perimenopause and why, just briefly. What are some of the treatments for menopausal symptoms? And we'll touch a little bit on the medical side of things there, and then move on to the lifestyle approaches, which is the next section. And then ask the question, where does that leave us? You know, if you're one of these women who is struggling with menopausal or perimenopausal symptoms, and remember that as the women struggle, their partners, their families, their husbands, whoever, also struggle because of the impact of the symptoms on women. So anything we can do to improve that lot will improve everybody's life, I'm sure. And I'm sure all the women out there know exactly what I'm talking about. Okay, so if I go to the next screen. Okay, so here's what I think of as a pretty typical case scenario. Here's Susie. She's 49 years old. She's had no periods for 13 months, which puts her into the post-menopausal, or she has gone through menopause, if you like, once you've had no periods for 12 months consecutively. She's gained 10 pounds in the past year, which we all understand too, I'm sure. She feels miserable and that she can't think straight. She's got brain fog, in other words. Her sleep's very disturbed. She wakes several times a night with hot flushes or hot flashes, depending on where you come from. Sometimes she even has to change the sheets because the bed is so soaked. She finds herself overreacting to her, let's say, sometimes difficult teenage daughter, and her husband tells her she is always grumpy. And of course, marital discord, intimacy issues are a major component of the struggles many women have at menopause. Her last work performance review was poor, and she was told she needed to improve because she was making mistakes at work. Plus, she was irritable with the customers. So life's a bit tough, and she comes home every night and has a couple of glasses of wine because it seems to be her only pleasure in life these days. So does that sound familiar to anyone? I suspect so. Okay, so here's our definitions page. What is perimenopause and menopause? I'm not sure if I've got the screen in the way. Hopefully I haven't, but do just let me know if I have. All right, so as I said, oops, I need to go back one. Now there's a trick. How do I do that? Okay, there we go. Okay. Um, Perimenopause and menopause, they're inevitable. Unfortunately, if we live long enough, we have an age-related decline in our ovarian function. Effectively, and this sounds harsh, I know, it's a form of castration. We no longer have our sex glands, so we lose the hormones. We lose estrogen, we lose progesterone, and we lose the the stimulating hormones, FSH and LH, from the brain, which actually are what stimulates the ovaries to produce estrogen and progesterone. So I like these graphs because I think they're a really good representation of what goes on. So here on the left, we have the normal cycle. And you can see if you follow each line's one of the hormones I've just discussed. It doesn't really matter which was which, but you can see there's a rhythmical, predictable pattern premenopausally. And then we get to perimenopause. And this typically happens somewhere around 45 to 49. Somewhere after 45 is in the normal range. And if you have perimenopause prior to that, that you may be a candidate for actually having menopausal treatment earlier. So you can see these lines don't have any rhythmical pattern. They're kind of all over the place and very irregular. And that's why if you go to your doctor and say, could you do some blood tests to check if I'm in menopause, each of these screenshots, if you take them at different points of time, would be very different. So it's not useful to do that, unfortunately. Now here on the right, we have postmenopause, or having gone through menopause, which we say occurs, as I mentioned earlier, 12 months after your last period. So if you get to 11 months and then you have a period, you are not through menopause. You are still perimenopausal. And you can see that the lines are straight, they're flat. This estrogen will be one of these two lines down the bottom. So we've lost our estrogen. The typical age for going through menopause is between 45 and 55, and the average is 51. So that's can, I hope, partially explain the chaos with the hormones. So menopausal symptoms. Now, if we had a bigger group, I was going to ask the group for any suggestions about menopausal symptoms. And anybody who can is welcome to chime in here. I mean, obviously, one of the ones we all know best are hot flashes. Any other suggestions from the audience? That's fine. I mean, my point was going to be every woman's experience of menopausal symptoms is quite different. And one of the issues that there has been in the past is women have gone to their doctors, they've discussed strange things that are happening, like an itching feeling like there's bugs under the skin. And the doctor says, well, I don't know. Basically, doctors like to solve things, I can tell you that, and they're not happy when they can't. And there's some terrible stories, historically, hopefully, historically, of doctors complaining about whining women for whom they can't find solutions. So I think that the key message here is to think in terms of anything weird and wonderful that's happening to you when you go through this change in life can be menopausal. And we loosely group them into these categories, which I'll go through in a little bit of detail without hoping to avoid getting too technical. But the vasomotor symptoms, which affect 3 out of every 4 women at menopause, the hot flashes, the night sweats. Now, we know that the night sweats and the poor temperature control is basically because of changes in the thermoregulation center in the hypothalamus in the brain because of low estrogen. And those hot flashes start in the brain. They're actually your brain heating up, which, as you can imagine, is not particularly good for your brain. So if we can avoid those, that may go some way to avoiding some of the impacts of menopause. Sleep disturbances happen for 2 out of 3 women, and these are due to the changes in the melatonin, the cortisol, and the estrogen levels. Very, very common, and unfortunately often carry over into postmenopause. Cognitive and mood changes occur because estrogen actually affects the neurotransmitters in the brain, like serotonin and dopamine. 1 in 2 women are impacted. We hear about brain fog. You there are women who actually develop clinical depression during menopause, and even so much disorder in their thinking that they really do suffer a crisis. So this is not something to be taken lightly. We know that serotonin and dopamine are the mood hormones. So it's not surprising that mood changes even in the calmest of women during menopause. And then there are metabolic changes. We probably all know about the increased central fat that we note around our tummies. Insulin resistance changes. Remember, insulin resistance is essentially the cause of diabetes. It means that our body cells need a higher amount of insulin to take glucose out of the bloodstream. And if our insulin resistance increases, in other words, we're no longer that sensitive to insulin, insulin itself raises in the body, which is linked to a number of complications, and we have high blood sugar, which is the beginning of diabetes. And that is something that we can work on and address, which I'll talk about in a moment. Muscle wasting also occurs. Unfortunately, we start losing muscle from the age of 30, and that is accelerated at menopause. And we also, at menopause, can have quite a precipitous loss in bone density, which leads to osteopenia, which is not quite so bad. That just means weak bone, and ultimately to osteoporosis in 1 in 2 women, unless measures are taken to change that. And then there's the fun genitourinary symptoms. So the low estrogen causes drying of the vulva and the vaginal area. It can lead to urinary tract and bladder symptoms, and also low libido. And this impacts 3 out of 4 women. So, it's quite a daunting list when you look at it like that. So the treatment, I'm just going to spend a little bit of time here on the medical treatment, and then I'll leave that alone and concentrate on the lifestyle approaches. There has been quite a change in the last few years. And this is international because I saw it in Australia, and the American Society, who basically write statements on which is appropriate treatment for women. They've come out in the last 2 years with statements on lifestyle evidence, which we'll talk about in a moment, but also on hormone treatment. And there's been quite a shift, which I really want to make sure that our clients know about this, because it's become clear that the Women's Health Initiative study from 2004 was not an appropriate study to judge the use of hormones in perimenopausal and recently menopausal women. That study was, the women selected in that had an average age of 62. They were older. They were some years post-menopause. So any harms that were found in that study do not apply to the group we're talking about today. And the new guidelines tell us that hormonal methods are for those women who do not have any medical risk factors, or who choose to, and not all women choose to. Basically, hormonal methods are safe and effective as long as they are started within 10 years of the last period or before the age of 60. Unfortunately, if you're over 60, or it's more than 10 years since your last period, hormone methods will not benefit you, and in fact, could harm you. And the other thing that's important is that women who started hormone treatment within that time frame, it used to be they'd say, we know that hormone treatment is safe for only 5 years. But now it's quite clear that once you've started within the correct time frame, you can extend it for longer. We don't know how long, and it does warrant ongoing review with your doctors, but definitely you can use it for longer with great benefit. And this is absolutely the most effective treatment for hormonal symptoms and menopausal symptoms. There are also some non-hormonal treatments which might be useful for that over 60 age group or those who can't or don't want to use hormones. And these are the antidepressants, SSRIs like fluoxamine and citalopram and SNRIs. Also the medications gabapentin, oxybutynin. These are useful for vasomotor symptoms and possibly also for some of the emotional issues. And a stellate ganglion block is quite a complicated medical procedure for women who have severe vasomotor symptoms. Cognitive behavioral therapy also improves well-being and it decreases the impact of menopausal symptoms on women. And interestingly, clinical hypnosis can reduce vasomotor symptoms, the hot flashes, in other words. So, lifestyle. Lifestyle is kind of a good news, bad news a story. And that's gone the wrong way again. Let's just see. Okay. All right. So let's have a look at lifestyle interventions. Now, the 2023 position statement of North American Menopause Society on this area, which is the most recent one, has found that weight loss is the only lifestyle intervention which has been proven to improve hot flashes. However, that tends to be for women who are early in perimenopause and for women who are obese before they lose weight. How for women in terms of lifestyle, the main impact is on general menopause symptoms. So general menopause symptoms, so this is really other than vasomotor, have been shown to improve with diet, exercise, and stress management, and have been shown to worsen with anything that increases inflammation, with poor sleep, and with the metabolic changes that can occur at menopause unless we are very proactive and avoid those impacting our health. The other really major point to take on board is that lifestyle changes at menopause are absolutely key to avoiding the chronic diseases that we can go on and develop. Because when we lose our estrogen, we become more like men in terms of our risk factors for high cholesterol, for heart disease, and for diabetes and so forth. So good health when you're postmenopausal is not an accident. We no longer have the reserve that we had. All those things we always knew we should have done and never quite got to, they're gone. We have no reserve. We have to take it seriously when we get to menopause. Okay, so next slide. What is in the lifestyle toolkit? And I don't think this is going to surprise you. We have diet, of course. We have physical activity, and I'm going to explore these in a little bit more detail. We have good sleep. We have mindset, and we have stress reduction. And these are all things that your coaches have talked about with you at length, and your coaches are a resource for you to improve these areas of your life. But just going over that briefly, let's talk about diet. Surprise, surprise, an anti-inflammatory diet is key to postmenopausal health. So that's the Mediterranean diet. It tends to mean that your markers, your inflammatory markers, so important in the group that we work with, people who have autoimmune conditions, your CRP stays low, and your cardiovascular markers, your cholesterol, your lipids, and so on. And an anti-inflammatory diet also helps make sure your body stays sensitive to insulin and you don't go on to develop diabetes. Sometimes we need supplements if we're not getting enough from our diet, and some things it's hard to get enough from our diet. And one of those areas that's really important is calcium and vitamin D, which of course is important for our bones and keeping our bones strong, making them stronger, building them up despite the hormonal changes which tend to break them down. We know that omega-3s are important for improving mood. They also decrease inflammation and they improve cognition. And of course, these are all things that you should run past your doctor and check with your doctor. I had a client the other day who told me her doctor didn't want her taking omega-3s because she has some kidney issues. So please do make sure before you start these things, you check with your doctors. We all need more than 25 milligrams of fiber in our diet daily. Most Americans don't get that. If we want our microbiomes to be healthy, our organisms in our gut need fiber. And protein intake's an interesting one. It's quite controversial out there, but it's apparent that we need at least 0.5 grams per pound of ideal body weight. So if my ideal body weight is 140 pounds, that means I need at least 70 grams of protein. I actually aim for more than that because I like to work out and do strength training, and to build muscle as a postmenopausal woman, I need extra protein because we're not so good at absorbing it. And even if we do absorb it, we're not so good at turning it into muscle. But that's an individual preference. And it's quite daunting if you think that an egg is 6 grams of protein. It's a long way from one egg at 6 grams to 140 grams. And that's where seeds and nuts and beans, as well as meats and dairy, all come in. And sometimes we have to take protein supplements. Another very important point in diet is we need to limit added sugars, alcohol, and processed fats. Those all create inflammation, which we're trying to avoid in all stages of life, but particularly this stage of life. Okay, physical activity. We need to move daily. And some of us have more ability to do that than others, but whatever, within our abilities, within our limitations, we need to get our heart rate up. We need to have aerobic activity daily, which is so important for our cardiovascular health. It helps maintain our sleep-wake cycles and improve our sleep pattern if we're physically tired, and our mood. We know that in if you're using antidepressants, it seems that a certain amount of exercise is just as effective as an antidepressant for many people if they have low mood or depression. Resistance training, in whatever form that takes for you, whether it's lifting weights at the gym or whether it's doing squats or walking on the spot at home, resistance training maintains bone density. It increases muscle mass, and it also makes sure we retain enough muscle to retain our sensitivity to insulin. And the reason I say that is it's muscle that takes up glucose from the bloodstream. So if we don't have much muscle, we tend to not take up so much glucose and we tend to develop diabetes. Daily, we should be stretching or using yoga to make sure that we stay flexible. And balance training is very important. None of us want to fall. We're typically less able to correct ourselves when we lose our balance. So it's ultra important that we work on our balance, which does deteriorate as we get older. Okay, so this next slide, which I am getting to the end here, so bear with me. I've kind of lumped everything together here. It's talking about sleep, mindset, and stress regulation, which all become greater issues at menopause, because these all change as our hormones change. If we have poor sleep, that means we have more inflammation, we have more insulin resistance, which remember leads to diabetes, and we have more mood symptoms. If we have chronic stress that we're not controlling, that will elevate the hormone cortisol, which in turn worsens anxiety and makes our sleep poorer. So these things all interact with each other. And then, of course, social isolation and a lack of purpose in our life also increases perceived symptoms. The symptoms feel worse and we feel more depressed. So these are all things to guard against. How do we do that? Well, I'm going to show you a list now that you probably have seen many times or talked about many times with your coaches. Mindfulness meditation. Meditation actually slows down the activity in the amygdala in the brain, and that causes the parasympathetic nervous system to be elevated, which helps us relax. So great for stress. And I must say, the days I meditate and the days I do yoga, I sleep much better those nights. Sleep hygiene. And again, this is something you would have spoken about with your coaches. Really important to get into a regular rhythm and stick with that rhythm. To avoid blue light, to have a comfortable, cool, quiet, dark sleeping area, and so forth. And remember that you all have access to the library where there are modules on these different aspects we're talking about. Avoiding alcohol. You know, we like to think of alcohol as being relaxing, to help us at the end of the day, but it's actually quite a sleep disruptor and a mood disruptor. And unfortunately, mature bodies just do not metabolize alcohol the way that we used to, and we don't do well. There's no nutritional benefit. There's a lot of calories. Really not a lot to be said for it. Sunlight every day will help and train our sleep-wake cycle. If we get up and have 5 minutes of exposure to sunlight, whether it's just going for a wander in the yard or sitting outside with a cup of coffee, that will help our sleep. And of course, we all know that time in nature is soothing and calming and good for our souls. And then there's the creative outlets, journaling, knitting, beading, whatever it is, gardening that works for you. Finding your people, finding a supportive community, going on walks, interacting with others, having an accountability buddy to do exercise with. These are all activities that feed us. I'd put in a special plea here. I've seen with my own clients that working on self-compassion and resilience can make a real change to them taking control of their lives and feeling like they can be the person they want to be in their lives. These are not necessarily things we're born with. We can learn them. So again, if you're interested in doing more on this area, talk to your health coaches. They're a wonderful resource. And then lastly, therapy, if need be, and if you find it helpful, or you all have access to health coaches, and make sure you use them to improve sleep, mindset, stress reduction, and so on. So, in summary, hormonal changes are natural and frankly unavoidable. And I cannot get past the fact after my research that absolutely the most effective treatment for the hormonal changes that are so difficult to tolerate is hormone replacement treatment, menopausal hormone treatment. If you go to your doctor and you're told you're not happy with what you're told, make sure you choose another doctor and get a second opinion, preferably one who knows and works in the menopause area, because there's a lot of medical people out there who aren't necessarily abreast of the recent changes. With respect, I'm saying that as a doctor myself. Lifestyle pillars like nutrition, physical activity, stress and sleep regulation, and social connection can all influence how the hormonal changes impact each woman, plus set women up for good health postmenopausally. So it's not about being perfect. None of us is perfect, but it's about creating a body and a mind that adapts better to the changes that come with the stage of our lives. And remember, many women spend about 40% of their lives in this last life stage. So definitely worth working on making sure it's good quality time. I've put some references, resources at the end here. Use Mac. If you go to Mac, our AI system with Musculo, you will find a lot of very useful information that is not commercially related. We don't have an agenda. There are always there are studies that support what is being said. And that was the basis of my talk. I should have added that I'm only giving you information that studies have shown to be true. So there'll be people out there saying, well, where is the red clover? Where are the various soy supplements? Unfortunately, the studies are not there that make that scientifically proven. So they may work for some people, but I can't recommend them as a evidence-based musculo health coach. I would highly recommend this book, The New Menopause, by Dr. Mary Claire Harver. It was just published last year. She also has a high social media presence with lots of very accessible presentations. Dr. Stacey Sims is another, she's an exercise physiologist, and she also has a high social media presence. She's particularly good with women who are interested in sport and in physical fitness. And then the Menopause Society is a national group who have some excellent, very short videos on non-hormonal and hormonal and lifestyle approaches to coping with menopause. So I would really recommend you to them as well. And I think that's pretty much my last slide. So thank you very much for your attention. I know we have a small group. I don't know if there's any questions out there.
I have a comment.
Sure, Trish, go.
I wish